Hari Om. The subject is knowledge of common diseases, their prevention and management by yoga. Now, first we have to understand what the word common diseases means. Because there are a number of diseases, they are categorized also in a different way. Let us understand this categorization. The first is disease as per the body system. That is the muscular system, skeletal system, respiratory system, blood circulation system. So every system has got certain diseases. So diseases can be categorized as per the body system. Secondly, it's communicable and non-communicable diseases. So this category is utilized in our courses. There was one lecture by Dr. Vidya Deshpande for non-communicable diseases. Then third category is chronic and acute. Some diseases continued for years together. It is called chronic disease. And some are acute at certain place they are there. So as per that also diseases are categorized. Then the age wise also. Early ages, young age, old age. Age wise also diseases are categorized. And now in our course, the categorization is common and non-communicable diseases. This is the categorization. And out of which non-communicable diseases have been explained to you by Dr. Vidya Deshpande in one lecture. So whatever balance is all common diseases. And that is what I am going to explain in this lecture. Now what is included in common diseases? All types of communicable diseases, namely cough and cold, flu, diarrhea, COVID, hepatitis, chicken pox, etc. etc. So many are there. And they can be transferred with the viruses and bacteria. So these are all common diseases. And of course, the antibiotic medicine is essential for curing these diseases. Because they cause because of some viruses. And unless the viruses are killed and removed from the body, diseases are not going to be cured. So for that, definitely the antibiotic medicines work very nicely. Secondly, all types of allergies, they are also included in common diseases. And particularly, there is no medicine for these diseases in modern medicine system. Because allergy is an abnormal reaction for a normal action. Things are normal. It's a normal food you eat, but you got some reaction. And it will cause the disease. So that is called allergic diseases. For allergy, yoga treatment is there, but that is for prevention. Because best solution for prevention is the best solution for these diseases, which we can provide with you. So likewise, we have to go on discussing all these things. Prevention is very important part. For that, we have got our immune system in our body. It's naturally provided to everyone. Now this is an inherent system for fighting external attacks of bacteria and viruses. Because bacteria or viruses, they enter in our body through food, through air, through water. That is why it is called communicable disease. Now when these viruses enter in the body gets the information, the brain gets the information, or the nervous system, you can say, through nervous system. Then brain develops the defense system for these viruses. It is called antibodies. And there is a struggle, another war we can say, from our antibodies and external viruses. And most of the time, these external viruses are killed when they throughout of the body. Then no problem, no disease. But when this system becomes weak, this whole it's called immune system. So immune system becomes weak for one or the other reason, or may not be sufficiently strong enough to fight. Then definitely the bacteria or viruses are not killed. They stay in the body and they go on multiplying very fast. And when they are staying at a localized place, they start disturbing the functioning of the cells for that particular area or particular organ, we can say. So this is an external attack of viruses which our immune system is not able to sustain, and that is why the disease starts. So the basic cause for these diseases is weakness of our immune system. Now yogic practices definitely help to build the immune system, bring to normal, or even strengthen it better, so that it will fight the external attacks of viruses properly and there will be no disease. Because when the disease is developed in the body, if the immune system is weak, then there is no medicine, as I already explained. Antibiotic is the medicine then. Antibiotic is also some poisonous things are there which are poisonous for the bacteria and viruses. And because of that antibiotics, the viruses are killed and removed from the body. And that is the cure. The yogic practices are not just like antibiotic. Please note. Yogic practices will develop your own immune system, and then immune system will be able to struggle with the viruses, and then immune system will be sufficiently capable of killing those viruses, and then the disease will be over. So it will take a time. But antibiotic is direct poisonous things which are killing the virus. But at the same time, this poisonous material can kill some of the good cells of the body also. That is a normal bad side effect of antibiotic, and everybody has to face it. And so some other problem starts in the body. To start with, it will be the weakness of some organs, because some of the cells will be get killed by the antibiotic. So that is a bad part of it, but that is essential also. Because if the viruses are not killed, they go on multiplying, and they will increase the infection, disturb the body functions, and the process will be continued as long as these viruses are not killed. So definitely antibiotics are essential, rather I can say. And that is why I already pointed out that after the disease starts, very difficult to cure with yoga. But we can make the prevention part of it. If you continuously practice yoga, regularly practice, then your immune system will be strong enough to fight with all the viruses, and there will be no disease at all. So that is what yoga practices can do for these diseases. Of course, in initial part also, suppose the disease is just to start, and the external attack is not so strong, but the immune system cannot face that attack. In that case, if you practice yoga, the immune system will be developed properly, and immune system itself will fight with the viruses, kill the viruses, and there will be no disease. So initial part of the disease can be taken care of by yogic practices, but advanced part, antibiotic medicine is necessary. So we must exactly note what yogic practices can do in this case. Now for this we have to just take a round what we can do to strengthen the immune system. There are 4 aspects for developing the immune system. First is ahar, second is vihar, and then achar and vichar. These are all Sanskrit words. I will explain in details. Ahar means the food intake. It is a major part. Because with the food we provide all nutrients, carbohydrates, proteins, vitamins to our body, which are required for every cell of the body. So proper diet also will help to develop the immune system. Immune system is also one of the system of the body containing a lot of cells. If those cells are strengthened properly with their nutrients and all that, they will work better. So ahar also, food is also is very important aspect which we have to take care of. Then vihar means daily movements, routine movements. Because body is designed to move. There is a number of bones are there, the joints are there, the muscles are there, ligaments are there. So many things are there for making the movements. And when the body is designed to make the movement, we must make the movement. But there is a limit also. So we must make the movements within the limit. That means we have to avoid the over activities of our body beyond the limit of the body. A limit maybe for the position, maybe for the time also. And we have to avoid the under activities also. Because if you don't make the movement, the joint will get disturbed. It will not function properly. Just imagine the shutter of a window or a door. There are hinges, joints, and that is designed for work, to work. You have to open and close few times in a day. So we have to operate. If you operate excessively, there will be excess wear and tear. The joint will get damaged. If you don't use at all, shutter you keep it closed for 5-10 years, and then if you try to open, it will not be open because it will get rusted. So if you don't use the joints of our body, same thing can happen. If you use over, the wear and tear will be there. So like this, we have to do the proper activities. That is more important. So to study the condition of all joints, and not only joint but movement of total body itself, and be within limit. Avoid under activities, avoid over activities, but do the proper activities. That is more important. So this part is very important for maintaining the immune system also. Then achar, it means the behavior, how we behave throughout the day with ourselves, with each other and all that. So behavioral pattern we can say. Because this behavioral pattern depends on the functioning of the mind. And mind is also a main cause for the many diseases. Particularly we call it psychosomatic diseases. When a disease is somatic, means body, the cause is in the mind. Because of the mind, because of misfunctioning of the mind, the disease can start. So for that we must have proper behavior. Physically, mentally, and spiritually also. So we can say that it's ethical things. All ethical things are mentioned for human behavior to maintain the health of the body and mind. That we have to follow the ethical laws, we can say, which are mostly common everywhere in the world. You go in any religion, ethical laws are there, and those are part of the religion maybe, but they are mostly designed for maintaining the health, physical and mental. And the last one is the vichar, that means the thoughts. Evil thoughts, bad thoughts, negative thoughts, they are disturbing the health. And that has been proved by experiments also. Many researches are there. Now everybody knows this type of thoughts, they are disturbing your physical health also. So these are the 4 aspects which we have to manage for maintaining the proper health, total health we can say. And of course, the developing the immune system also, these all 4 points are very important. Now to manage all these things, we have got the techniques of yoga. That is what we have to decide. There are asanas, shatkarmas, that means cleansing processes, pranayamas, dhyan, that is meditation, yoga nidra, om chanting. These are the main practices which can provide proper energy and training for the immune system also. And total health also, of course. So this is good for prevention also. So let us consider one by one to some extent. We already learned so many things on that. But still some important points I will just mention here. Asana. Yoga is well known by the asanas. It is an important component in treating the patients. And there are thousands of asanas. Different types are there and all that. You know very well that. And different asanas are prescribed for the different diseases. That has been practiced and found out by experience. And some researches are also there. A particular asana is good for particular disease. Like that categorization is there. There are many books are also available. They also discuss on this part that particular diseases. That is okay. But now the main important point I want to insist is how to perform these asanas. That is very important for patient for curing the disease. In normal condition, this procedure is explained rarely. The positions are there, different asanas. Those are explained. So it is taught that you attend the position in any way. That's all. But just attaining the position of asana is not sufficient for the patient. So there are different levels are there which I am going to explain. Those are very important. The results of asanas are dependent on this procedure. If you change the procedure, result will change. And that is why it is important. So for a particular disease, particular asana is okay, but in which procedure it is to practice, that is more important. So for that, I want to explain some different levels of practicing the asanas. And this is based on Patanjali. Patanjali is the original pioneer of yoga, you know very well. So he has explained the theory of asanas in 3 sutras. So depending on his sutras only, I have designed these different levels of practicing asanas. First sutra is Sthirasukham Asanam. Steady and comfortable posture is asana. So to remember perfect each and every word of this, because each and every word is important. Then how to do that asana? This is a definition of asana. How to do this asana? Patanjali is explaining in next sutra. Prayatna Shaitilya Ananta Samapattibhya. Is giving the 2 ways. Prayatna Shaitilya is one and Ananta Samapatti is another. Third sutra is of course for the result of asanas, which is the result of all these 2 sutras. But the practicing levels are depending on these 2 sutras only. So this is a theoretical explanation as it appears. You say, oh, this is theory. It's okay. But theory is to be connected to the practice. And that is more important. And that is why I am doing. I am connecting all these the 2 sutras to the practicing of asanas. Now Patanjali has explained only 3 sutras. He has not explained any particular asana. That is quite clear. But these asanas which we practice, they are explained in Hatha Yoga mostly. So Hatha Yoga describes the detailed procedure of many asanas so that we can practice easily. Bhujangasana, Chalavasana, Dhanurasana, all these asanas. In Hatha Yogic text, detailed procedure is explained, detailed position is explained. So we are practicing accordingly. But now we have to combine these 2. We can apply Patanjali's theory to these theories of asanas for better and proper results. This is more important. Many of the yoga experts don't agree with this. They say Patanjali's theory is different, Hatha Yogic asanas are different, don't connect together. But in particular, I want to insist, yes, we must connect together so we can get better results. If we don't connect, we are going to get some results. They are good. But if you connect both of them together, you will get better results. And this theory I am going to explain to you now. So in these two sutras, Patanjali mentioned 4 points. Sthira means steadiness, Sukha, comfort, Pratna Shaithilya, relaxation, and Ananta Samapatti, concentration of mind. So we'll base the procedure of practicing asanas on these 4 words. And you know, in sutra, each and every word is very important. When it is used by Patanjali in sutra, it must be given proper importance. Don't just overlook these words. That is what I am thinking. So I will give proper weightage for each and every word during the practice of asanas. So let us see now. Now considering all these 4 words and applicable to the practice of asana, asanas can be practiced on the following levels. First is I have given a number as 0. Normally we start with 1, but I have given starting with 0 because this level is not yogic level. It is non-yogic level. But we can practice this level asanas also. And the explanation is we have to make the fast movements and without steadiness. And fastly you attain a posture, release a posture with fast speed and all that. Mostly we observe this in circus or acrobats. Their asanas are done with very fast speed. They are attained the position, immediately release the position. Or even I can give the example of Surya Namaskar. Very interesting example. Surya Namaskar can be practiced fast, can be practiced slow. So if you practice Surya Namaskar with fast speed, maybe 1 round in 15 seconds, then it will become 0 level practice. But if you practice with normal speed, 1 round in 1 minute, it will be level 1. Got it? That is more important. So Surya Namaskar can be exercise because this is a 0 level is exercise level. When we do exercise, we do fast speed, it's not slow speed. 0 level is exercise and not yogasana. But it is there because for Surya Namaskar, when we have to teach for the obese persons to reduce the obesity, their exercise level is useful. So we ask them to practice 32 rounds in 8 minutes with fast. That burns the fat. It gives the result, no doubt. But not for other patients. Other patients, maybe 1 round in a minute or maybe something slow also. So anyway, this is 0 level of asanas. In level 1, first level, most primary level we can say. It is slow movements you have to practice asanas, but without steadiness. Just attain a posture, release a posture, but attain a posture with very, very slow speed. Release a posture with very, very slow speed. And this normally a beginner in yogasanas can practice like this. Of course, afterwards we are increasing the timing. Steadiness of asanas we can increase 15 seconds, 30 seconds, 1 minute, 3 minutes like that. But in the beginning, we just attain a posture, release a posture. So this is the primary level, most primary level of yogasanas. So all asanas are practiced on this level also in the beginning. Next level is with slow movements and with steadiness for a certain period. Sthira, Patanjali says no. So we have to maintain this sthirness, steadiness for a certain period. So it will start from few seconds, it can go to minutes, and ultimately it can go to hours also. Because Hatha Yoga prescribes that you are a master of asana when you maintain the asana steadily and comfortably for 3 hours on prahar, then you are like master of that asana. That is mentioned in Hatha Yoga also. In Hatha Yoga also expects that you have to maintain the asana posture, but with comfort. That is important. As Patanjali said, steady and comfortable posture. So as long as it is comfortable, you can maintain. And that is what we are doing in our class also. In Yoga Vidya Gurukul, Sarvangasana, the students have to maintain for 3 minutes in Yoga Pravesh course, 5 minutes in Yoga Parichaya course, same asana, 10 minutes in Yoga Prabodh course, 20 minutes in Yoga Praveen course, and 30 minutes in Yoga Pandit course. Same asana is to maintain for a higher and higher time. So this is a second level I can say, that we have to maintain for certain period. That period may vary from person to person, it may vary from asana to asana also. But some period is there that you have to maintain it, continue your normal breathing, and then you release. And of course, attaining releasing is with very, very slow speed. That is common. Going ahead, level 3 is slow movements with steadiness for a certain period and relaxation of muscles. Prayatna Shaitilya, what Patanjali said. You have to apply this Prayatna Shaitilya for practicing the asana. So this becomes level 3. That is, you have to make very slow movements, maintain it steadily and comfortably for a certain period. And during that period, you relax all the muscles, just like Shavasana. So this is level 3. This is also very, very important because when you relax the muscles, the stretch on the muscles can be transferred to the inner organs. And that is what is expected in therapy. Or even maintenance of the proper health also. Because in every asana, some muscles are stretched, some muscles are compressed, shrink. That is always there. So keeping the same position, we have to relax all this stretch and compression of muscles. So that will be transferred to inner organs. And inner organs are also made up of muscles. So they are stretched or compressed to some extent, and they will work more efficiently because of that. Because of the stretches and compression, blood supply will increase, nerve supply will increase to the organ, and organ will function better. That is how we select asanas for a particular disease and then practice on this particular level. In the level 4, we have to add the fourth word of Patanjali, that is concentration of mind. Fourth level means we have to attain a position with slow movements, keep a steadiness for certain period, relax all the muscles, just like level 3, and concentrating the mind on any organ of the body. So, Ananta Samapatti. Patanjali has mentioned concentrate on Ananta, but we modify it, concentrate on the organ which is faulty. Suppose a heart patient, we are asking him to concentrate on his own heart. Diabetes patient, the pancreas are wrong, they are not functioning properly. So we'll ask the patient to practice maybe Ardha Matsyendrasana. Then practice with slow speed, maintain it for some time, relax all your muscles and concentrate your mind on your pancreas. So this is level 4. So most of the diseases we have to practice level 3 and level 4 asanas. But arthritis and all that, they can't practice on this level. For arthritis patient, we recommend level 1 only. And for obesity, we may recommend level 0 also. So like that, we have to recommend the level also, not only the asana only. And level 5 is, of course, ultimate level of, as explained by Patanjali, that is concentrating the mind on infinity, Ananta Samapatti, which includes first all these things. That means slow movements, steadiness for a certain period, relaxation of mind, relaxation of all the muscles, and concentrating the mind on infinity. This is a final level as per Patanjali's theory of asanas. This is not required for the patient. This is for the expert practitioner. And this can be achieved with a very long practice of asanas. So this is not required for patient, but for patient, first 4 levels and plus 0, that means all 5 levels are important. So when we recommend certain asana, we have to recommend the name of the asana, but we have to recommend the level of the asana also. Then it will give the result. Suppose Ardha Matsyendrasana asana is good for diabetes. It is already proved by researches also. But if it is practiced on level 1 or 2, it is not going to give the result, but that will not affect the functioning of pancreas. And the patient is not going to improve. But when he practices on level 3 and 4, relaxation of muscles and concentrating mind on pancreas, that will give the very good result. See, asana is same. If you don't practice properly, proper result will not be there. And this is very important aspect of practicing asanas. So when we are recommending, we have to recommend asana as well as level of practice and teach also accordingly. Of course, we have to teach very slowly. It is not on the first day only we teach level 3 and 4. To start with level 1 only. Don't start with 0. Start with level 1. Slowly proceed to level 2, level 3, level 4 like that. And level 4 is out of consideration for patient, so don't worry. So this is how different asanas are recommended for different diseases and particularly to improving the immune system. Let us come to the pranayama now. There are different varieties. First is deep breathing, then alternate nostril breathing, then holding of breath, that is kumbhak. Then there are ashtakumbhakas explained in Hatha Pradipika. And for kumbhakas we have to teach bandhas, Mula bandha, Jalandhar bandha, Udyan bandha. And there are different types of pranayamas without kumbhak also. With kumbhak also, without kumbhak also. So all these different varieties of pranayamas can be used to improve the immune system for the patient. Different ashtakumbhakas are explained. Suryavedan, Bastrika, Brahmari, Shitali, Sitkari, Ujjayi, Murcha, Plavini. We have studied, you have been explained all these things, so I am not explaining each and every pranayam detail. But this Plavini pranayam in particular, that is not explained in the text also properly. So we don't understand how to practice. Normally it is not practiced also in regularly. But other 7 pranayamas are definitely useful. Of course, these pranayamas can be practiced with kumbhaka, without kumbhaka also. Mostly for the patients, we recommend without kumbhaka. Because when you want to teach kumbhaka, you have to teach bandhas. Jalandhar bandha, Udyan bandha, Mula bandha. And it takes a long time. And that patient must have physically capacity to practice as well as proper time also. But say good results we are getting without kumbhak. Normally for patients in normal condition we recommend without kumbhak. In certain cases we have to recommend with kumbhak also. But both way we can make use of this thing. But the pranayam starts with deep breathing, deep breathing with both nostrils is a starting point, which provides more oxygen, which gives more strength and all. So other things was already explained to you, so I don't want to repeat all those things. But you know the advantages of deep breathing, then advantages of alternate nostril breathing also. Because alternate nostril breathing is left nostril, right nostril is stimulating, left nostril is coming down. So all those different effects are there. So depending on the effects we can recommend deep breathing, alternate nostril breathing. Then if you want to make use of this 8 kumbhakas, that also we can recommend. So this recommendation will be depending on the type of disease. But basically it will work to improve the condition, to strengthen the immune system, and the immune system will be able to fight the disease and the disease can be over. So like that different asanas we can use the different pranayamas with different techniques. The next point is dhyan, that is concentration of mind. Actually, Patanjali has explained dharana, dhyan and samadhi. Dharana is concentration of mind on certain object. Dhyan is a pinpointed concentration of mind. And samadhi is merging with that object. This is how the Patanjali has explained this technique in the 3rd chapter. Deshabandhaschittase dharana, tatra pratyaya ekatanata dhyanam, tadev arthamata nirvasa swarupa shunyam iva samadhi. If you consider using these techniques for patient, then samadhi is of course out of consideration. This is the highest development of the practitioner, where the question of disease doesn't occur at all. Dhyan, yes, okay, it will be useful, but dhyan also is very difficult for a common person. But dhyan as per Patanjali's definition, please note. Because dhyan word we use in common for concentration. So it means dharana only. So we can say dhyan also is not possible for a patient, but the dharana is possible and useful. And dharana is deshabandhaschittase dharana, you have to concentrate on certain object. So concentration of mind, that is why actual word we have to use is dharana, but word used in common practice is dhyan only. So I'll also use the same word, but the meaning is dharana, please note. When I use the word dhyan, it is not Patanjali's dhyan. It is a general word used in common language as concentration of mind. But as per Patanjali's, it is dharana only. Anyway, let us see the effect of concentration of mind. Because mind is very powerful. And mind is controlling the whole function of the body. I can say mind controls brain and brain controls all the functions of the body. So ultimately mind is responsible functioning of each and every organ of the body. But mind is diverted, mind is powerful, energetic also. A lot of energy is there. Full energy is there with mind. But it gets diverted in number of directions. And so there is no effect. Now let us see the effect of concentration of mind. Further, I want to give the example. Now in sunlight, heat is there, but that heat is not sufficient to burn a paper. That is a common sense, you can understand this. In sunlight, the heat in the sunlight is so weak that it will not burn the paper. But when we use the lens and concentrate the light rays as well as the heat rays, so we'll concentrate that heat on a particular point. And the heat will be so much that the paper will burn. This is a common experience we practice. When the paper burns with the help of lens, from where the heat came? Heat was there in sunlight. But without lens, it was not concentrated. So the heat was not sufficient to burn the paper. But when we concentrate that heat, it is sufficient to burn the paper. The same thing happens with the mind. Mind has got tremendous energy, but it is diverted in all directions. But when you concentrate the mind, that mental energy is concentrated, and that concentrated energy is definitely useful for stimulating the functions of the organs. And that is what we are making this technique in previous practicing the asanas, level 4. Concentration of mind on the particular organ. So likewise, when dhyan or this dharana only, concentrating the mind provides the concentrated mental energy. Then where to concentrate, how to use it, that is our chance. That we have to decide. Then concentration of mind removes the mental blocks. Because mind is functioning continuously, but there are many mental blocks are there. Something we can't consider, we cannot think, the mind cannot work. So many mental blocks are there. But concentration will remove the mental blocks. So concentration will purify the mind. And because of that, the mind improves the mental powers. Power is there, but it is not streamlined properly. So concentration means practicing dhyan or dharana, we can increase the mental powers. And concentration of mind develops the self-confidence. Yes, I can do it. I can fight with this disease. When you decide like that, mind is ready, the body also will be ready. Body parts will function accordingly. Immune system will develop. So this is very effective for developing the immune system also. And that is our point of consideration in this lecture. So these are the effects of concentration of mind. Plus, concentration of mind helps the curing process. Because curing process is done by the body itself. We can provide some medicine, we can provide some external means, even yogasana pranayam. But actually, curing process is carried out by the body itself. Maybe the mind is useful, nervous system is there, all skeletal system, bone system, everything is there. So that helps to develop. So this curing process will be stimulated by the concentration of mind. When concentration of mind increases the vital capacity of body and mind. The process is little bit simpler, but it gives lot of good results. Then concentration of mind stimulates the brain functions because mind is controlling brain. When it is concentrated, energy also will be concentrated. So definitely brain functions also will improve. Then concentration of mind maintains the harmony of the body components. Because the body contains number of components, Now they are all should work in harmony, perfectly matching with each other. When you are running, your leg muscles should function fast. But at the same time, your breathing is high, so it will provide more oxygen to the leg muscles. But at the same time, heart will beat more to provide that blood to the muscles. And we see all these organs should work together, supporting each other, not against each other. So this is called harmony of the body. If the body harmony is disturbed, definitely something can go wrong. So concentration of mind can maintain this harmony of all the organs. So all the organs will function in cooperation and they will give the good result. This is also a good effect of concentration of mind. So this is all about meditation. Now the Shatkarmas, that is cleansing practices. Hatha Yoga has explained the Shatkarmas in very details. And it's called Nadi Shuddhi. That means purifying all the nadis. It is mentioned that there are 72,000 nadis. That means it includes the channels of blood, food, air, also sensory and motor nerves. All these are nadis. Because blood flows through the different vessels, arteries, veins. These are all nadis. Food is flowing through the digestive tract from mouth to anus. That is also a nadi. Air is flowing through the channels, air tubes, bronchial tubes and all. That is also nadis. And even the sensory nerves and motor nerves, these are also nadis. So all these can be purified and that is called Nadi Shuddhi. And for Nadi Shuddhi, there are two things are explained in Hatha Yoga. Now the blockage in these channels, nadis, leads to the disturbances in the harmony of the body. And this disturbance is disease. That means purification of these nadis is essential for overcoming the disease. And if you maintain the purification of all the nadis, then that is prevention, we can say, for all the diseases. So all this Nadi Shuddhi, there are two parts are explained. One is Nadi Shuddhi Pranayam. That means Anulam Vilam with all three bandhas and kumbhakas and all that, And secondly, these cleansing practices. So these cleansing practices are effective to remove the obstacles in case of diseases. Because somewhere some obstacle is there and that is why the functioning is suffered for the particular organ and the disease has started. If you remove the obstacle, the flow will be normal. That flow may be anything, maybe blood, maybe nerve, maybe food, maybe air, whatever it is, what we discuss. So that definitely will overcome the disease. Then the Shatkarmas can keep the channels clean to improve the functioning of different organs. That is maintenance. When we observe particular city, there are different nadis channels, pure drinking water pipelines are there, drainage pipelines are there, gas pipelines are there. So this must be clean, no? If the obstacle is there, it will not function properly. And for obstacle, it should not occur. Normal cleaning is done by the corporation departments. So our body also, this all channels must be maintained clean so that the obstacle will not be there. So that can be done by Shatkarmas. Then Shatkarmas look abnormal, Woman, normally we drink water with the mouth. Here we have to expel the water through the mouth. Nose, we are inhaling, exhaling air. In Jalniti, we have to put water in this nasal passage. So like that, they are abnormal. So that is why the regular practice can establish the control over autonomous nervous system. Because abnormal things are also controlled by brain, and it is called autonomous nervous system. Because in normal condition also, in some cases, if you eat some wrong food, natural process of vomiting takes place. I mean, it is controlled by brain, autonomous nervous system. It's not in our hand. But by practicing Shatkarmas, we can get control over autonomous nervous system to some extent. So accordingly also these Shatkarmas are recommended for certain diseases, for certain patients. Now there are in three practices, Yoga Nidra, Omkar chanting and Shat Chakras. Of course, these practices are discussed separately in some different lectures. So I did not repeat them here. Now all these practices were discussed from asana, pranayam, meditation, Shatkarma, Yoga Nidra, Om chanting, all these practices will definitely improve the immune system. Because these practices can improve the total body systems, which includes immune system also. So for improving the condition of immune system, these practices are definitely going to help. And they will also help to overcome the allergy problem also. Because allergy means, as I told you, it's abnormal reaction of the body for a normal things. And body should not give abnormal reaction, but it gives for normal things. That is allergy. That means something is wrong with the body functioning. Now, yogic practice are purifying each and everything. So that function also will improve. Body will give proper reaction. So allergy problem is over. So whatever is included in common diseases, can be prevented and managed properly with the practice of yoga. That is the ultimate conclusion of my lecture. So, Hari Om.